Hi everyone, it's Nigel Giam here, the lead GP training program director for St Mary's Scheme, course director for Mentor, Med Education and Mentor SEA and AKT. I'm really happy to have Farhad here today, joining us. I feel like I've known Farhad for quite a long time, and we've gone through a pretty challenging journey to SCA success. But SCA success, here we are. Congratulations, and it's really lovely to see you. Lovely to see you relaxed by a beach, even though it's virtual.
Yep. Yeah. Thank you so much. Yeah. Yeah. I've been knowing you for ages.
I know, but it's been lovely actually, and I've been actually really looking forward to this interview. Just to, well, firstly, see you again and congratulate you. But
Thank
the reason we do these interviews really is to consider why people are falling down in what is really a challenging exam. Perhaps before we get into that, do tell us your kind of journey into general practice. Do tell us a bit
yeah.
about yourself.
So I mean, I came in into this country back in 2018 when I did my master's for University of Glasgow. I did sports exercise science and medicine. I found really good. Then thought about let's go to the clinical because as a doctor it is hard to pursue a career in
Yeah.
sports medicine. So then I chose to be a GP. So I started my GP training back in 2021 August.
Hmm.
And it went smoothly so far. I passed my ATTitude with a brilliant score. I thought I'm gonna pass the SCA without any problems.
Yeah.
The things started to become more difficult and started to become more challenging after my first attempt
Yeah.
back in April 2024.
Yeah.
Then I reached out to you.
Yeah. Gosh, 2024. So that's so I was thinking it has been a bit of time, but okay, now we put a date to it. And I think on that note, a lot of people have slight misconceptions, I think, really
Yeah.
when they approach the exam. And it might be worth us starting there for those people who are doing it for the first time and starting to prepare, but those who are also resitting. I mean, what are the common misconceptions about the SCA and how people approach it? What was your
Yeah. I think
flavor around it?
one of the main sort of misconception I felt and I had as well is I felt this is a clinical exam.
Yeah.
So, which is, and now if someone has this sort of mantra, someone knows this has this misconception, that's enough to fail the exam.
Yeah. Yeah.
Because which I did, which I obviously I have found out in in my
Yeah.
results, and as
Mm.
you've seen my feedback, more doctor centered.
Yeah.
So, it's no way to pass this exam without with just thinking solely on clinical skill
Yeah.
because even if you pass management, no matter how good you are in management, no matter how good you follow the nice guidelines, literally each and every bit, you kind of gonna still fail the interpersonal skill
Yeah.
because that was not the patient's sort of preferences agenda
Exactly.
you have addressed in the management.
I know. And so
I felt.
this is the biggest misconception. I think
Yeah.
people when they look at the SCA, they see it as a simulated clinical assessment, but it's not, as you said. Actually, underpinning it, it's a high challenge, essentially communication skills assessment, which means clinical management is actually encompassing the patient, their agenda, their health beliefs. So if we now, I suppose, break down what we did differently
Yeah.
and we worked hard to break down these misconceptions. We can break it down into the three domains. What
Yeah.
would your game changers be for those now sitting in autumn in terms of data gathering? What do they need to do differently if they're very clinically driven?
Yeah. So, I mean, data gathering part, I mean, you have seen my feedbacks. I passed most of the stations in data gathering, even if I was doctor centered, because data gathering is more sort of if you have ruled out red flags, if you ruled
Mm,
out, reached a diagnosis, no matter how you have reached, uh, unlikely you have, unless you have missed a significant clue
mm,
that going to affect your management,
mm.
most of the times they will pass.
Yeah,
However, there is a really thin line between passing data gathering and clear pass on data
yeah,
gathering, which I
exactly.
had so many clear passes this time.
Yeah,
So if you start with the data gathering, what I would suggest, just go with the patient's narrative first.
yeah,
Don't
yeah.
box the patient. Don't start asking question with the, like, for example, patient coming with a chest pain. Just don't go into it straight away.
I know, yeah,
Where does it go? Where does it come
yeah,
from? And do you have any associated symptoms? Don't
yeah,
go
yeah,
with it. It could be an absolutely completely different thing.
yes,
Patient come with the assessment, patient might want something else,
I
discuss
know,
something else. So it's so important in data gathering, the more sort of the patients what's coming for, and explore a bit more, and explore eyes really quickly
Yeah.
before you jump into the different jump into more relevant
Yeah.
questions to rule out red flags and
Yes.
differentials.
Yes.
It's so important. And
Yeah.
I felt that one of the main important thing which I was missing was not priming the case, which I have to absolutely tell everyone.
Yeah.
This is the biggest game changer
Yeah.
because even in my exam, this is I don't know how
Mm.
this is the first time it happened. I had 7 investigation stations, so there's a lot of investigation stations.
Wow.
So there
Okay.
are some of the cases there are 3-4 pages long of
Notes. Yeah.
all the clinical
Yeah.
informations. If anyone wouldn't go through all of this, couldn't prime it well, the chances that he might not able to reach to a diagnosis and
Yeah.
manage properly and with the time
Yeah. Yeah.
constraint.
I so agree. So you've highlighted really three key points here, which is know your place in the patient's journey. Know what's kind of happened before, use that information contextually to consult, with a patient who has definitely going to, in a standardized exam, have an idea, concern, and expectation. So we want to be using that information of case priming to then, secondly, also use ICE to focus our line of questioning on the patient's agenda. And that's when the clinical stuff can come in when
Yep,
we can then ask
absolutely.
about symptoms and system, which is that third point. But it is so interesting, isn't it, what you said about when a patient just comes in with a symptom, our brain, for example, will immediately go, okay, Socrates, site, onset,
Yeah.
character, radiation, associated.
Yep, yep,
And we just keep doing that, especially in study groups.
yep.
We're sitting with clinical case books, and clinical case books don't invest in narratives, unfortunately. They're clinical case books for a reason because they focus on the clinical aspect, and that's a very dangerous place to be, isn't it? When you're in those study groups, just going through those ticks. So if we move now to clinical management, which you have highlighted and we've discussed, is not just the management of the symptom or the diagnosis, but of the narrative. What would your advice be to those out there again to maximize their marks and data gathering?
Yeah. I mean, I found this time I have so many clear passes again in clinical management. So clinical management is so important and it's easy to gain marks. So if someone has gathered enough data based on the narratives and look out for psychosocial bits as well, just put everything in place addressing ice
Yeah,
in the beginning, which I did in most of the cases, and the patient will be more relaxed.
yeah,
Patient will feel more they have listened they are listened to. So
yes, yeah,
and they will be more willing to accept what you are saying.
yes,
So
exactly.
we can do this shared way of managing. So
Yeah,
which I felt, and when I
yes,
did
absolutely.
explore their eyes their attitude changed completely. So when
Yes,
I'm telling them these are the things we could do,
yeah,
so these are the ways we can. So I have few suggestions to
yes,
help you. So one of these is
yeah,
this. When I said this, oh doctor, what it is? What can I
yeah,
do? Oh yes, can you tell me a bit more? So
yeah,
they become more interested.
yeah, yeah,
So because I've given them options,
yeah,
and
yeah,
then because in a management it will be two ways. So whenever we give them something, this is gonna we could do based on that, they will ask questions.
yes.
Absolutely, and they will have a lot of questions.
Yes, yeah, because the simulator is actually there to help you.
Yeah,
I think what a lot of people find in the SCA is when they come out, oh, really difficult patient, they're asking me lots of questions, but they're doing that to actually get you back on track,
yeah,
to
they
help you
do.
score marks, to move from that fail zone to the pass zone to the clear pass zone.
Yeah,
So actually, the more questions that you're getting from a simulator, it often is because they're trying to push you into a higher mark zone.
yeah,
And this aspect of readdressing ICE is so important because often what we do in the first half is we ask ICE just like a tick box.
yeah, yeah,
Then
absolutely.
actually we just forget about it.
Yeah,
We just like I've done it now. I don't need to worry about it. You know. So a patient might have come in with a worry, and we don't even readdress that worry. We just go, we think it's this. The patient's like, but why isn't it that?
yeah,
This is what I was worried about. This is what I wanted to talk about today. So that brings us nicely onto, I suppose, relating to others,
yeah,
because again, it it isn't just about being nice in this exam and doing what a patient wants you to do.
yeah.
I mean, we've highlighted in previous SCA case studies with other candidates that actually, you can get a fair amount of negotiation in an SCA circuit, and often actually you're not going to be able to meet a patient's
Yeah,
expectation.
yeah, I had few cases, absolutely.
Yeah.
Absolutely.
So
And
what
full
would your
video
game
assistant
changes?
case.
What would your game
Absolutely.
changes be when you recognize early on, I'm not going to be able to meet this patient's expectation.
Yeah, yeah. I mean, in a few cases, I did in the beginning. So after opening the patient's, after listening to the patient's narrative, and then patient does give that clue really quickly.
Yeah,
When you listen, when we listen to the patient really in a open way, then the patient does give the clue.
yeah,
They drop the clue really quickly. Though, so
yeah.
then you this way you know that okay there will be a negotiation case, which I felt. So
Yes.
it's really easy, straightforward for me.
Yeah.
So because when I went to the management, I know there's gonna come
Yeah,
there
yeah,
is some
yeah,
resistance
yeah.
coming back. Then I used the word dilemma.
Yes.
Absolutely.
Yeah,
So using the word dilemma is helpful because then you can find your grounds,
yeah,
all the justifications based on the guidelines and
yeah,
things you can offer.
yeah,
And at the same time, you can, when patient is not accepting, you can still ask why he's not accepting,
yeah,
why he or she's not accepting,
yeah, yeah.
what is that holding them back? So
Yes.
again, renegotiate.
Yes. Yes.
We do
Yeah.
the same thing.
Yeah.
They're saying different approach. Like for example, if patient is coming with the type 2 diabetes, not
Yeah.
well controlled, patient doesn't want any anti-diabetic medication. So you know why they're not taking
Yeah.
wanted.
Yeah.
Then give them the complications. So this might
Yeah.
happen.
Yeah.
Dilemma is if you don't start this medication,
Yeah.
what might happen is you might have it put at risk of heart
Yeah.
attack, stroke. Still doesn't accept. We can give more options. Why not
Yes. Yeah.
we just book a follow-up appointment?
Yeah.
And we're
Yeah.
just doing we don't have to
Yeah.
decide it today. Why don't
Exactly.
we just
Yeah.
to keep a track of everything? I
I,
did have a
I,
clear.
I really like this. This is actually this is a different theme that we haven't really sort of talked about with previous SCA candidates. It is negotiation, but it's often renegotiation, isn't it?
Yeah,
And actually, what happens is if a simulator has shut a door, and actually they've been told to keep that door shut,
and they do it really well.
yeah,
I'm telling
they
you,
are
they do it
not
really well.
they are not going to open it. And actually the tendency for people who fail is to try and get a sledgehammer and smash that door down. And it's not going to open. So you've got to find another route, you've got to find another option, and you've just got to keep renegotiating. So I think that is a really, really good tip for everyone out there. We teach this other acronym as well. Well, we
Yeah,
talked about this a lot actually on our previous master classes and one-to-ones. That actually, it isn't just about ideas, concerns, and expectations. It's about LICEF, which is how it affects a patient's life and how they feel about the situation.
yeah,
And I think what you've mentioned here now is, if a patient is feeling, I'm not going to do this, we need to actually acknowledge that feeling in order to move forwards. And so, what I mean, a lot of people come to me and go, I don't understand, Nigel's LICEF, AEE. I mean, we've talked about LICEF now, but what does AEE
okay.
mean to you? How does someone
Right.
actually encompass active listening, empathy, energy? How did you apply this?
So that's so if you remember my previous attempt, so I was scored really badly on interpersonal skill. I would more than happy to show you my this time my relating to others. Obviously, I failed 4 stations by clear pass on 6. So my interpersonal skill went shoot up
Yeah.
this line. So it's just any patients comes with any confusion, doctor. My ex or
Mm.
my family members asks me to come to you, they're a bit concerned. Okay, so, but the first approach was, don't worry, you've done
Yeah.
the right thing.
Yeah.
You've come to a safe place.
Yeah.
Let's talk about it. So, can you tell me what's been happening and what is that concerning them?
Yeah. Yeah.
Then explore why they are concerned.
Yeah.
So they said, okay, about that. And what about you?
Yeah.
Are you concerned?
Yes.
So this is how I scored that clear pass
Yeah.
in
Yeah.
the person, and I passed actually on it literally every domain and then
Yeah.
then station. So it's not much. It's just I'm telling them, okay, I can see your concern.
I can see. Yeah.
That's not enough. I can see your concern. Obviously, I'm here to help you, and
Yeah.
we'll find out what way we can
Yeah.
help you best.
Yeah. Yeah. Yeah.
So let's talk about it. And the
Yeah,
simulator.
and then as you unfold those cues, you can empathize with the situation around. And I
Yeah,
think that's that, as we begin to close, you're absolutely right. The simulators will drop those cues quickly. And
they.
it's so dangerous to go, I'll talk about that later, or I heard that cue, I'll put it away.
Oh gosh, that's it. If you say
But
that, that's it.
it's game over. I mean, in real life, sometimes we have to do that. There's too much happening, but in a standardized exam, that is the king queen of the consultation, the cue.
And I think you struggle quite a lot with me, especially putting that in my play in my
Yeah,
brain because it is hard because in the real life, what happens is Your trainer is saying one thing, you are saying one thing,
I know.
and we are doing another thing. It is so difficult
Yeah.
to really know what it is, because whatever we are doing in a real case, in a real hot scenarios, if you want to put those structure in, it is really hard because
No,
patient
yeah,
just goes
I
over
agree.
whatever he wants.
I know,
And
and
then
and actually, I'm so glad you've mentioned this because yesterday yesterday I did 7 1-to-ones back to back, and it was exhausting. And the issue is about dewiring what it what works well in real life, but doesn't work so well in a standardized exam.
yeah,
Because I mean, I've been a trainer for over 20 years, and when I'm sitting down with my trainees and doing work-based placed assessment, I've
mhm,
got a COT hat on, as you say, open questions, let the patient talk, golden minute, but these things don't exist in a standardized exam.
no,
You know, tell me more in a standardized exam is often met with what do you want to know?
yeah.
Is there anything I've missed? Well, what do you want to ask me? You ask me, I'll tell you basically. So,
Absolutely. So this is exactly what I felt before. Well, anything else? Oh
yeah,
God, I've never had to use this word
yeah.
ever in my exam.
And that is so important. Anything else does not exist as a
No,
question.
they have given you enough information. You just
I
need to
know.
base,
Yeah,
to just to gather more information
yeah,
on top on basis of that. You
yeah,
can't ask anything else what the patient would say.
yeah, yeah.
No.
Well, that's really useful actually, and definitely a different slant from the other case success stories that we've had. So thank you so much, and it's really nice just to see you relaxed. I mean, actually, to be fair, our one-to-one sessions were really funny, and actually, even though I put you under so much pressure, you always had a smile despite so much
Oh
other
God.
stuff happening around you. And obviously, I
Oh yes, the other
remember
thing I
that.
forgot about what happened on my exam day.
Oh yes, do share that. Yes.
Yeah, you see, it was, I mean, uh, yeah, I mean, obviously, on few subsequent attempts, we don't really pay that much attention to what, I mean, because you were already in so much pressure.
Yeah.
So what I did is I would usually wake up 4:22 a.m. in the morning for morning prayer. So
Mm,
it happens, I don't know how my AM alarm switched to the PM. I didn't know.
right.
So, and this is the only time it snooze every 5 minutes
Right.
unless you completely shut it down.
Yeah.
So
Yeah.
what happened in the exam? Obviously, the phone will be silent. You can't
Yeah.
switch the phone off. So everything was okay. Went in. Um, I don't know. This time they checked the ID check just 2 minutes before starting the exam, while I was sitting there for half an hour. Absolutely stressful. They did not come in, and they came in and say,
Mm,
"Look at you. This or that. Everything is okay." Got back right in, started my consultation, and at three again at 4:22, my alarm went off, and
oh.
I was in the middle of the consultation.
Oh no. Yeah.
And the first thing I did, I just initially just silent it off, just shortly.
Mm,
Obviously, that I just focused on my station. Then I realized, no, this is my alarm. So what I did differently from you heard about other people's who had problems and had issues. What I did before I reaching to my phone, I send a text message to the admin team that
okay.
this is my alarm
Yeah.
in between my reading time.
Yeah.
So this is my alarm. I'm glad that there was nothing much on the reading time.
Yeah. Yeah. Yeah.
Read about that time.
Yeah.
I was glad. So I'm gonna reach out for my phone.
Yeah.
I'm gonna take it to my hand. I wrote it literally clearly everything to the
Yeah.
admin.
Yeah.
Then I showed it to them. Then I put my phone in and I showed it to them. This is my
Yeah.
phone, and I just showed them literally everything what I
Mm,
did.
mm, mm,
And
mm,
I
mm.
told them I'm gonna switch my phone off. Then I put it away. Now after 2 days later, I received a message from the head of the examination team that you have done, there is a misconduct of
Yeah.
using a phone, especially a station, particle
Yeah.
station. Then they asked me, do you have chances to explain yourself? Which I did.
Yeah.
And
Yeah.
then nobody called me. My phone was on silent. I'm more than happy to provide all
Yeah.
the
Yeah.
contact details, whoever calls.
Yeah.
And please check this chat box
Yeah.
because I told them clearly what I was doing.
Yeah. Yeah.
And at the end, they said, it's just a verbal written warning. They let me go.
But how stressful is that
Oh,
after
God.
the exam to receive that? And actually, this has not been an uncommon scenario. I've had a lot of trainees actually contact me with similar issues, and I think it is obviously a really stressful day. But just go through those checks for yourself that your phone
Yeah.
is not going to go off, that, nothing's going to happen there because we just don't need this additional
No.
stress. And unfortunately, there have been some cases where, the appeals have not been successful.
Oh God.
And I mean, that's just awful, isn't it? But let's end on a positive note, which
Yeah.
is, you've now got through this really high challenge case. Um, if you had to say one thing to someone who's feeling a bit down in the dumps now, because there's plenty of people out there,
Yeah.
what would you say to them? Because they're going to be thinking this is going to be a miserable summer. I've got to resit this exam.
Mhm.
What would you be saying to these people?
So obviously I had a miserable summer.
Okay.
So, yeah, I went through that stage. So, yeah, don't lose hope. My supervisor is really good. He does say really good things. Say your consultation are not going to get any worse. So you are gonna be a better GP
Yeah,
more time. So it is not gonna happen that you're gonna get worse. So whatever you have, whatever you have prepared for, whatever you have gone through, it's likely that you're gonna get better.
yeah,
But just stick to the narrative of the patient, which
yeah,
I would say. And obviously you need to practice a lot.
hmm
And those sort of questions, the clinical questions, will follow automatically.
yeah,
Have to just you don't have to think about it. If you practice more, it will automatically come through your mouth, and you don't even realize that you've asked
yeah,
those questions,
yeah,
unless you need to follow the narratives because you need to see where you are in the patient journey.
yeah.
Otherwise, no, it is difficult,
Not going to happen.
especially with the management relating to
Yeah.
others.
Story before symptom, before system, patient before diagnosis, as we've
Yeah.
always said on the masterclass. Fahad, what are the plans now? You're going to CCT when?
Oh gosh, yeah, again bad news. I'm supposed to have my ARC was supposed to be on 24th of July, which is next week, and they changed it to the 9th of September. So
Oh no.
I've got a
Okay.
salaried post already with my current
Good.
um,
Excellent. Well,
employer.
I'm glad you've got a job lined up because the market out there is quite tough as well,
Yeah,
isn't
I didn't hesitate. I said, no, no problem at all. I will
it?
just
Just
take
take
it.
it. I'll take it. I'll take
I'll
it.
take it. And I'll do locums
Oh, good.
if I can do, yeah.
Well, look, thank you so much for coming on, and it's been an absolute joy to get to know you. But obviously, the journey's not over. I'm here. Whatever advice you need, please stay in touch.
I will. Thank you.
And thank you so much again. You take
Thank you
care.
so much, Nigel. Thank
Okay,
you so
okay.
much.
Bye.
Take
Bye.
care. Bye. Bye.